Uh, Good morning. Today we are uh, operating on a 7-year-old female child. She had a large interpalatal fistula. That was like a challenging case. We did 1 month back. So we closed her interpalatal fistula in 2 layers. The nasal side using a nasal floor mucosa, and the oral side was covered with a bilateral buccal myomucosal flap. Now we can see the flap is healthy and it has added to the palate nicely, and the fistula is also closed completely. But because the flap was coming between the bite, we have to uh, cut the flap from its base because the patient is not able to close her mouth, and the flap is coming between the bite. So today we are depedicalizing and revising our flap, and future plan, because she has a constricted upper arch, so she will go for the palatal expansion followed by pre-surgical orthodontic treatment, and then around 13-14 years we will do her anterior maxillary distraction, and later date we will do her lip revision and rhinoplasty.